I'm joining by phone, but hopefully that's okay.
Yes, no problem. Great to have you. Thank you. And hope everything's okay.
Yeah, it's fine. It's a little complicated, but fine. Thank you.
Good.
Hello there.
Hello.
Hi, Katina. How are you?
Let's give it one more minute and then we'll get started. Thanks everybody for joining today. Okay. I think we are now live on Facebook, and so we'll get going. Great. Thanks so much for joining us for this really important webinar. It's great to see you all. My name is Delegate Brooke, and I represent, along with my co-conspirators, District 46 with Senator Bill Ferguson and Delegates Robin Lewis and Luke Clippinger, and we're proud to represent the 46th District in Baltimore City in the Maryland General Assembly. But of course, we work at the statewide level to help make changes that affect the entire state and many folks in all counties. So before we begin, I just want to make a few points about where we are today, and then I'm really excited to have some fantastic speakers today to talk about the immigrant experience and how we can support our members of the immigrant community in Maryland during this really challenging time. You know, I think being an elected official is really about more than passing legislation, right? It's also about connecting people with the resources that they need, driving discussions about important topics, and making sure that we are keeping in touch with one another throughout really challenging situations like this, and working with our hospitals, with our local governments, and with our nonprofit and advocacy partners, like those on the call today. You know, I often say that with COVID and this pandemic, we are all in the same storm, but we are not all in the same boat. Many of us are in boats that are rickety and old, are full of holes, and need much more support because of systemic barriers and systemic racism that has really impeded them throughout their lives. So starting in mid-March, of course, our country shut down life as we know it, and the country attempted to provide relief to many of its residents, stimulus checks, enhanced grant and loan programs for businesses. Unfortunately, of course, many of these programs and many of these offers were not available to many in the immigrant community. They really excluded people from who often sometimes needed the most support. And that left it up to nonprofits, community organizations, and faith-based organizations who have had to step up in a way, and our local governments, to provide relief. You know, I don't think it should be that way. Of course, we're all here and we all do better when we all do better. And that means that we are here to support one another. You know, I'm thrilled today to have some amazing leaders with us who are really leading the way in supporting our immigrant community, showing us how we can support our immigrant communities as well. I've been thrilled to have the opportunity to work with all three of these individuals and their organizations throughout this pandemic. Just last week, I had the opportunity to tour the brand new Casa de Maryland headquarters in Baltimore City. It's amazing. You know, we worked really hard to bring it here, and there's amazing food operations going on out of it. And they were boxing up foods and prepping things to go to deliver to immigrant families around the region who we know are being affected at a much higher rate than Caucasians. And so it's so important that they're here, they are doing that work. So I'm going to introduce our three panelists, and then I'm going to turn it over to them to hear their thoughts on what's going on, how we can be supportive, and what the organizations are doing. So Gustavo Torres is the Executive Director of CASA and the President of CASA in Action. He's a nationally recognized voice on immigrant rights, human rights, voting rights, and really all issues facing the Latino community. His organizing background has helped make CASA one of the country's most successful grassroots organizing groups, and it's the largest immigrants' rights organization in the Mid-Atlantic region, with offices in Maryland, Virginia, and Pennsylvania. If you don't know CASA, I'm thrilled that you're on today so you can learn about them because it's such an important organization here in the state. And Catalina, District 46 resident, great to have her on today. Catalina is the director of the Mayor's Office of Immigrant Affairs in Baltimore City. And as the director of MEMA, Catalina is responsible for promoting community well-being, economic development, and the inclusion of immigrant and refugee communities in the city of Baltimore. So her office has been instrumental throughout this pandemic in making sure that we are never forgetting communities that can't speak English, that maybe don't operate through what we consider normal channels that are just sort of, often the white channels. So it's great to have her here doing the work that she's doing, and which is so much. And then also Dr. Kathleen Page. Dr. Page is an associate professor in the Division of Infectious Diseases at Johns Hopkins University School of Medicine, and her work focuses on promoting health equity for migrant populations. She is the founding co-director of Centro Sol, the Center for Salud or Health and Opportunities for Latinos, which through programmatic interventions, research, and advocacy addresses the impact of immigration policy on health. She also directs the Access Partnership, which is called TAP, to provide access to effective, compassionate, and evidence-based primary and specialty care for uninsured residents at Johns Hopkins. Centro Sol has also, like CASA, been instrumental in helping to make sure that we can provide food and other needed items for immigrant families around the region. And if any of you are interested in volunteering with CASA or Centro Sol, we will also put that information up in the chat box throughout this. So thank you so much for joining us today. I think with that, I'm going to turn it over to Gustavo to kick us off. Oh, you're muted. Unmute. Let's see.
I am on mute already. Can you hear me?
There you go. Now you're
awesome.
unmuted.
Awesome.
Perfect.
Again, thank you so much, Delegate, for this opportunity and for your support to CASA for these many, many years. These beautiful new facilities that we have right over there in our city in Big Paris because your commitment and support. So I really, really appreciate this. So thank you very much. But today we are going to speak about a very, very important issue, and is this coronavirus crisis in our community and how that is impacting and what we are doing and how you, all of you who right now are listening to us and watching us can help us. So, but before we started, I just want to mention something that is very important also for CASA and for our community. We want to express our solidarity and we stand with the Black community in this very difficult moment. We need to fight for social justice, for police reform, to make sure that we are going to fix the crisis that we are facing in Maryland and around the nation. So I think that is very important that we speak about that. But secondly, now I want to speak about this crisis that we are facing. 27% of the people who have been impacted by the coronavirus in Maryland are Latinos. We represent 9.5% of the population. So you see, it's astronomical numbers, and it's creating a huge impact in our families and in our communities. In fact, not only we have been impacted by this crisis, but also, the federal government passed a legislation and we didn't qualify. The Latinos and immigrants didn't qualify for the stimulus package. So we say, like, how we are going to do, what we are going to do in the middle of this crisis, how we are going to help people in these hardships and these insecurities, how we are going to help to make sure that we make a contribution to our community. So we decide to respond in two different ways, and you know that because you have been part of this from the beginning. Number one, in April 8th, we started our food distribution, and we started right over there in our city. And you were part of that. You know that you were part of that, participating very aggressively and very active. And we started only with 100 families. Now we expand this to 600 families in the Baltimore region. More than 4,000 individuals have benefited from this, and we continue doing that. We believe that is very, very important. Now we are also expanding this in Montgomery and Prince George. We are doing this in Virginia and in Pennsylvania because our community are in a huge crisis. So that for us was very, very important, and we continue doing this because it's so very, very essential. The second piece is that we believe that was very important to create a solidarity fund. And we partnered with the city. Catalina, thank you so much, because you also were part of, we have, right here, we have a lot of, I call my partners in justice, people who really want to make a contribution to our community. And Catalina is one of them. Immediately say how we are going to help, how we can coordinate, how we can work with the city. So the city immediately say, we want to make sure that we also make a contribution to people, regardless of the immigration status, but people who live in the city and also around the state, who are making a great contribution to the society, to the economy, to the culture, to everything. And the federal government make a decision that you are now worth to qualify for the stimulus. And we say this is unacceptable. So we create the Solidarity Fund. And Delegate, we are very pleased to share with you that as of today, we fundraise around $4 million.
Wow,
from
that's
so
phenomenal.
many people
Wow.
that you help to identify, Delegate, people who make a contribution, individual donors, foundations, the local government, so unbelievable, directly from the community, people who receive the check, the stimulus check, send that check to us back and say like, we don't need the check, please donate that to the community. It was so beautiful, and it's so beautiful to see the extraordinary solidarity and the commitment from the community. So again, $4 million. So now we are in a process to make a distribution to many thousands of families in Maryland and also in Pennsylvania and Virginia, but in Maryland, in Baltimore County and Baltimore City, because we believe that that is the contribution that CASA is making every single day. But in addition to that, and let me finish because I know that I don't have a lot of time, is that we keep providing services to our community regardless of this crisis. So we started to do the digital work, and a lot of people call us to our offices and say, I still need workers. I need somebody who cut my grass. I need somebody who paint my house. I need somebody who help me with different issues. So we immediately send the workers. In the last 3.5 months, Delegate, more than 2,000 workers got a job through our process, through our digital process. So it was just unbelievable. So that was a kind of the contribution that we do. And we also are doing a lot of, making mask distribution in Baltimore. 2,000 families are receiving that, and all around the state. So we are very proud of the work that we're doing, but we need to do more work. It's so very important that we continue working with this community who are in need. The crisis is very serious. 27% of the cases are Latinos and immigrants. 29% are African Americans. So we are in the middle of a crisis. We just heard from the CDC experts. People are very concerned about these two communities, Latinos and African Americans. The impact is huge, and it's our responsibility to keep working on this and to keep providing services. So again, thank you so much, and I'm happy to answer any questions that people may have.
Thank you so much, Gustavo. I really appreciate you being here today. So appreciative of all the work that you're doing. I really think of it as a partnership. I'm so proud to represent District 46, which has a huge number of Latino communities and immigrants. And there's no way that I personally could help all of them. And so anything that I can do to support your efforts, Central Soul's efforts, that's my job, is to make sure that we can be supporting people during this time when the federal government is really AWOL. Despite the fact, of course, that all these immigrants, they pay taxes, they are not able to benefit. So thank you so much for your work. And now, Lena, I'm going to turn it over to you, and I believe you have a PowerPoint, so I will share my screen, and you can just let me know when to go through each, when to flip through, and I'll flip next. So give me 1 second.
Perfect, thank you. And let me just start by saying that thank you so much, Delegate Learman, for this opportunity, and to Gustavo, who is a rock star nationally, and for all the work that CASA does in our city. We wouldn't be able to be where we are without them. And Dr. Kathleen Page also has been really instrumental during this pandemic. So thank you so much. So again, for those who don't know me, my name is Catalina Rodriguez Lima, and I'm the Director of the Mayor's Office of Immigrant Affairs. Next slide, please. And as Delegate Learman mentioned, our mission is to promote the economic growth, community well-being, and the integration of the 50,000 foreign-born individuals living in the city of Baltimore. Very quickly, for the next slide, I'm going to talk about our traditional roles and responsibilities. As an office, we advise the mayor, cabinet, senior staff. We serve as a source of information. We provide technical assistance to city agencies on matters related to policy, outreach, resources, messaging, best practices. We do a lot of community outreach and relationship building. Baltimore is traditionally a city of neighborhoods. However, a lot of our immigrants are not necessarily accessing those platforms. And because of that, we work a lot with nonprofits serving immigrants, ethnic civic groups, faith-based communities, schools with large numbers of ESL students, and ethnic media. We also manage the City Language Access Program, which is responsible for making sure that agencies, city agencies are equipped to serve people who can't speak English. And we staff community groups, temporary and permanent groups, such as the Baltimore City Hispanic Commission and MEMA's Community Advisory Board, which serve as oversight bodies of the work that we do. Next slide, please. Since the beginning of COVID, our role as an office has shifted to meet the needs of the community, mainly in these 4 areas. Emphasizing the role of language access and making sure that information was available in multiple languages, serving as a source of information and creating a series of communication channels for the community to be informed. We've also worked a lot in providing technical assistance to city agencies to overcome barriers related to language, immigrant status, and the digital divide. And lastly, we are supporting immigrant families excluded by the CARES Act. And I'm gonna go over every single item of this. Next slide, please. In our role as a language access manager, we early on joined the Joint Information Center, which was the clearinghouse for information coming out of the city of Baltimore to make sure the information was translated in the city's 4 languages, which are Spanish, French, Mandarin, Korean, and Arabic. As you may know, a lot of the information coming from the governor's office was only in English, which left us scrambling to translate information as quickly as possible. Luckily, we have the systems in place to make that happen. To this date, we've translated close to 60 documents in at least 3 languages for a total of 200 documents produced by our office. And all of these documents can be found in our Facebook page and our website and any other communication channel that we have created. Because the pandemic forced us to move to telephones and websites, we also instituted a universal telephonic interpretation account, and we provided training to all city employees and call center operators on how to assist people who can't speak English over the phone. We also made sure that all of the city's websites had access to translation so that people continue to have access to information. Next slide, please. Our second role as an office was of a source of information to make sure that people were informed about the pandemic, but also about the changes in services at a local level. We quickly instituted 5 communication platforms. Our Facebook page released information on an ongoing basis. We also created a weekly report that provided information on the changes of public services. This report has now shifted to a bi-weekly report. We created a weekly update in Spanish in partnership with Somos Baltimore Latino and Dr. Kathleen Page, where we actually, every Friday, we get together at 3 p.m. and provide updates about city services. And Dr. Learman, I don't know if you want me to stop for questions or if you want to take those at the end.
We can take questions at the end for sure.
Okay, perfect. We also instituted a weekly call with community stakeholders to learn about the changes in services and the pandemic. That call now has moved to a bi-weekly schedule, and our next call is scheduled on July 10th. And finally, we created a dedicated page on coronavirus where we list information about health rights, economic relief resources, healthcare resources, and really anything that has to do with coronavirus in 5 languages. Next slide, please. Another one of our roles has been serving as a technical assistance provider for city agencies. We've been working a lot with the health department and making sure that information is translated, that programs and services do not have barriers related to immigrant status. We've been working with the planning department to make sure that documentation is not requested when people are accessing foods, and that we are taking into consideration public charge as well, so people are not afraid about accessing services. We've been working with the Baltimore Development Corporation to make sure that the business grant was available to business owners without a social security number. And to that, we also expanded our capacity by creating a pool of volunteers who help business owners with the application over the phone. And we're currently working with DHCD on the rental assistance program, which is scheduled to open tomorrow. And again, the idea with this is that we are anticipating any barriers that our communities are likely to face through these applications. What I will say about this is that a lot of the programs that are coming out as a result of COVID, as part of the economic relief, while we are pushing to have immigrants without a social security number included in the process, there will be immigrants who will be left out, because a lot of the documents that are requested may include people who have an ITIN number, because there are some income verifications and whatnot. So there are still immigrants who will be left out, even though we are trying to anticipate and troubleshoot barriers prior to these programs being released. As a result of that, we are creating a program called the Emergency Relief for Immigrant Families, and that's the next slide. Which seeks to provide assistance to undocumented immigrants who have been disproportionately impacted by the pandemic. As Gustavo mentioned, our immigrant communities are more likely to be impacted because they're essential workers, they're working on the front lines, they have limited access to resources and healthcare, they live in multi-generational and more crowded households, and perhaps the most important piece is that they have been excluded from any federal benefit provided by the CARES Act. This includes, they don't qualify for PPP, they will not receive a stimulus check, they cannot apply for unemployment insurance, and because of this, many of them have limited sources of income, and in many cases continue to work with symptoms because they have to provide for their families. We know that in the city of Baltimore, we have close to 16,000 unauthorized individuals, and at least 3,000 of those individuals have at least one US citizen child. However, these parents are barred from receiving cash assistance or the stimulus money that is being provided on behalf of their children. In addition to that, mixed status families, this means a spouse who is a US citizen with an undocumented spouse is completely disqualified from receiving the stimulus check. So in response to this, our office has established the Emergency Relief for Immigrant Families, which is an initiative that seeks to raise public and private funds to support 2,000 families and 500 individuals. Under this program, families will qualify for a one-time disaster relief donation of $500, and individuals will qualify for a $250 donation. Next slide, please. This program is not open to the public. Instead, we're working with 12 community-based organizations that are identifying families and individuals that meet the criteria of residing in the city of Baltimore, have a child under the age of 18, have been economically impacted by COVID, and have been excluded by the CARES Act. And CASA is one of the partners, so thank you, Gustavo, for your support with this. Families are being identified on a weekly basis and payments are being made on a weekly basis. We hope that if we are able to raise all of the funds that will help us, support 2,000 families and 500 individuals, that we would disperse dollars by the end of August. Next slide, please. One more. Just, can you go back one slide?
Sorry.
And as I mentioned earlier, this is a strategy to raise public and private funds. We have a dedicated page for people to donate to this program. I will say that we are very close to reaching our fundraising goal, and that is possible thanks to many foundations who have been really responsive to this community and many individuals along with local government. So thank you so much again for this opportunity, and I'll wait for questions at the end of the program.
That's great. Thank you so much. I'm going to turn it over to Dr. Page now. And Kathleen, I don't know if you can see them, but we do have your slides if you want to talk through them.
Yeah, so unfortunately, sorry, I can't see the slides. So I'm not sure that I'll use them, although I know what they say. Maybe I would just, I think there's the second or third slide has, I lots of things they reiterate what was said, but I'll talk about some of it.
Yeah, there's the positivity rate. Yep.
Yeah, why don't you stick to that one, and then I'll talk about the rest. So thank you, first of all, Brooke, for having me, and really thank you for all who are listening, and to Catalina and Gustavo. I mean, Casa and Nima have really been some incredible partners in all of this really difficult time. As Brooke said, I am an infectious disease doctor working at Hopkins, and early in the pandemic, I feel like it was maybe in March when things were starting to happen. I wrote a perspective, worrying about some of the issues that have been brought up, worrying about what the impact of COVID-19 was going to be specifically on undocumented immigrants for many reasons. The fact that the CDC, for example, was giving recommendations that people should stay home and call their doctor before they came to the hospital, and I knew that that so many in our community don't have a doctor to call, that the hotlines initially were not set up to man questions in Spanish. The fact that the public charge had dampened the use of services, and so many families had disenrolled in SNAP prior to COVID-19, and now that was leaving them in a bind, especially as work opportunities were disappearing, and so on and so forth. I have to say that when I wrote that perspective, I had no idea how bad COVID-19 would be for this community. I had a sense that it would be bad, but I had no idea. And it really has been devastating. I would say by the end of March, and particularly beginning of April, I've been working with this community for a long, long time. And frankly, nobody has paid too much attention, let's put it that way, especially, at Hopkins and other places. Even the number of immigrant patients that come to our system is actually quite low, because many immigrants, as you know, coming here to work, they're fairly healthy, so they don't tend to use our system that much, our healthcare system. And also they avoid it as much as possible because they're worried about bills and they're uninsured. So truly, prior to COVID-19, if you walk through the Hopkins wards, you would occasionally see a Spanish-speaking patient, but rarely. You would see more in the OBGYN section because of delivery, but that really was a sort of special area of the hospital where we took care of a lot of immigrants. And then in the pediatric practices, because the pediatric practices would take care of the now U.S.-born children of immigrant parents, you would see a lot of immigrants. But otherwise, you really, occasionally. Well, starting in April or late March, I started getting so many emails from so many different places, and from NICU attendings to people who are looking at the data, from people who are manning the hotline, which is the line that takes referrals from other hospitals for patients that need higher level of care. And the message was all the same. What is happening? There are all these immigrant patients who are Spanish speaking coming to our system. We've never seen anything like this. I think at the sort of height of the wave that hit our community particularly high, about 40% of the hospital beds and ICU beds in the hospital, not only at Hopkins and at Bayview, but also at Suburban and other hospitals that Hopkins is part of, were Spanish-speaking immigrants. This was truly unprecedented. And there were so many challenges. Early on, I partnered very closely with the Director of Language Access in our system. She's fabulous. Her name is Tina Tolson. They were doing everything they could, and they have a fabulous group of bilingual interpreters. But there were so many challenges because patients, hopefully none of you have had to be in a COVID unit, but it is a very isolating situation for anyone, even if you speak English. You're in a room or you're in the ICU, but almost no one goes in. So interpretation was happening through phones, and with the PPE, nobody could understand anything. So it was really quite complicated to communicate with patients. It was also complicated to communicate with families because this was, again, new for everyone, but because of various challenges, language, health literacy levels, I think families were, the attending, the doctors were feeling that they were not able to help these families, especially through very difficult decisions like end-of-life decision, etc. So we set up a consult service. We identified bilingual providers in our system and set up a consult service called Juntos, which means together, so that basically to facilitate direct conversations with doctors and nurses and with the patient. So instead of trying to have these complicated conversations through third-party interpreters, we would go to the rooms, we would talk to the patients directly. And what we found is that patients then opened up. You know, it's actually, I'm sure all of us can imagine trying to have a complicated medical conversation in language we don't know with a third person trying to interpret everything. You know, these conversations tend to be somewhat stunted and end up being like yes, no questions and answers. But by having someone, a provider in the room who speaks the language, there's all these things that open up and people ask much more questions, and then we were able, I think, to help the patients and get a better understanding of what was going on and why we were seeing this. And I think the why is not a surprise. I think both Gustavo and Catalina have mentioned this. This is a community that was excluded, had been excluded for years from everything. There were disincentives to seek healthcare. And when COVID-19 hit, and there was, you know, these are low-income essential workers who, because of their low income and because they're often here to send family money back home to their country, or, you know, to support their families here, they're saving as much as they can. Many of them. I mean, I've worked with this community for a long time, and I knew a little bit about housing conditions. I had no idea how bad it was. You know, when I would talk to patients, they were like, you know, there were 10 men living in a 2-bedroom household with 1 bathroom. There were 5 families living in a 4-bedroom household, each family of 5 in 1 bedroom. This was a situation that it was a tinderbox. You know, people had to go out to work. They were not getting the stimulus check or any unemployment benefits, so they had to go to work. Many people didn't even have transportation, so they were being picked up in vans to go to work where other people were sick, and so there was lots of opportunities for transmission there. The employers, I think many of them were trying to do the right thing, but you know, they also didn't have access to PPE or maybe the right information, and so the protections to employees were not adequate in many cases, and these employers were not, the employees, you know, again, undocumented, were not empowered to really be able to advocate for themselves. So we, you know, we recognize that the CDC has made beautiful recommendations about how, if you have been in contact with someone or you have COVID-19, you can isolate at home and stay in your bedroom and bathroom, and that all works very well if you have a 5-bedroom household with several bathrooms. It doesn't work so well in these situations. And so how do we respond to this emergency from a public health as well as a, you know, humane standpoint? So we worked really, really hard. At the same time, the health department, the EDs, they were contacting my small team of bilingual patient navigators to try to help. And so, you know, they dove in, and I have to say that Alejandra, Anna, their team was incredible, worked the longest hours ever, weekends, trying to do contact tracing, trying to get people the resources they needed. We partnered with the health department, with NEMA, to advocate for housing, to have the hotel, the Lord Baltimore Hotel, open their doors. It had been set up for people who were homeless to be able to isolate, and we just kept on pushing and pushing. You know, when people are living in these crowded situations, it is the same as homelessness. They cannot isolate. Please open the doors. And eventually that happened. Although, you know, because of, I will say that I knew that I wasn't naive about this, and this has been reported all over the country, that although this is an option, and we have fabulous outreach workers who are trying to convince people to go to the hotel, the reality is that there's a ton of mistrust that comes from years and years of mistrust, and I think people are very hesitant to go to a hotel and not understand like what's going to happen there. Are they going to be with their family or not? So there are real challenges, even when resources become available. Centro Sol Casa helps a ton with food because, again, difficult to isolate if you don't have food. You know, I am truly quite concerned. It's interesting because when you see these disparities, and I think the graph that I'm showing is a graph of the positivity rate among different race and ethnicities in our system, and you can see that the positivity rate among Latinos was over 50% for a really long time. On average, it was 42% compared to much, much lower in every other group. This indicates two things, both not enough testing and not enough access to testing, as well as increased transmission in the community. What's interesting though, and these disparities are seen, as Gustavo has mentioned, all over the country. Now, what has not been so apparent is the disparities. There's been huge disparities among African Americans, and it's been devastating, the mortality rate in that community. When you look at, I think that data for Latinos is still starting to come out, and we don't have a full understanding. When you see, for example, age-adjusted mortality rates in New York City for Latinos, they are actually as high as they are for African Americans. But it's important that this data is looked at with age adjustments, because the Latino community is younger, and so as expected for a younger community, you would not expect the same mortality as in a population, an 80-year-old that living in a nursing home. So it is important that when we look at mortality, we don't just look at numbers, but look at the age adjustment. In Baltimore and in Maryland, the reported data, it does not look like the mortality among Latinos is that high. To me, that's surprising, because I have to say that I have been involved in too many of these conversations and end-of-life conversations. What I am concerned, and I don't think is being captured right now, is that there's a lot of people in our communities have had very prolonged, serious ICU stays, and some of them have very significant sequela. So they're not dying, but they're surviving with severe neurologic impairment. And in a group of people where there are no disability benefits, where there is, people have to, if they don't work, they can't survive. It is a huge concern for me, what's going to happen. And then the other thing I'll say quickly that really was so apparent is that when I looked at the data on people who were admitted to hospital, and among Latinos, the diabetes rates were the lowest that they were in any other group, which is surprising because we know that diabetes affects the Latino community disproportionately, actually, and Latinos have the highest rates of diabetes in the country. But then once they were hospitalized, they were diagnosed with diabetes, and many of them had very poorly controlled and probably long-standing diabetes. I think this just represents what happens when a population consistently gets excluded from primary care. Right. So there were lots of undiagnosed conditions that then led to complications of COVID-19, et cetera, et cetera. So we basically have a ton of work to do with, expanding access to primary care. So much work to do. Communication and making sure that people get the right information. Expanded testing. Hopkins, as maybe some of you have heard, has now sent up these GO teams that are generally used in humanitarian settings, but we're now using them here in our own city to provide testing in Sacred Heart Church. But one thing that is, again, concerning to me is that while a couple months ago people were desperate to get tested, now we are hearing from the ground that people are reluctant to get tested, because the question I get actually is, why should I get tested? There's really no treatment, although there is treatment. It's not a medicine, but oxygen and other things are treatment. But also, most importantly, I'm worried that if I get tested, I will get fired, I will lose my housing, and therefore there's real disincentives to getting testing at this point, and that is a problem.
Yeah, that is a problem.
So anyway, so I think, again,
thank you.
It was a horrible wave. Unfortunately, the wave is sort of coming down, although the positivity rate in our community is still very, very high. And I suspect we'll have more cases soon enough. And I just hope that we're more prepared for the next time, and that we've learned from this situation.
That's the perfect segue, I think, into one of the first questions that folks typed in, and that I think is really important to talk about, and look forward to hearing thoughts. Gustavo, Catalina, Kathleen, your thoughts on this is just, I think, the pandemic has really crystallized the inequities that existed previously, that were pre-existing in the system. And, now there's no looking away, right? As you were saying, Dr. Page, people are coming in, they haven't been to a doctor in years, so they know, there's so much going on with them medically that it's making this much worse. There's distrust, right? Of course, founded distrust, like understandable distrust of institutions, because also many of those institutions haven't, government institutions haven't done the right thing and haven't reached out to communities to be inclusive of them along the way. So I think there's this question of, how do we build better, right? Like, how do we create more resilient institutions that are more connected to communities? Certainly, like, CASA and Central Soul's role and MEMA's role have been so important because they had pre-existing networks, right, to get information out to people. And without that, it would have been even more of a disaster. But how do we make sure that that's not sort of, and there are special channels, but that there is, that it's just part and parcel of everything that every government agency does? I'd love to hear, your thoughts and comments on those. Gustavo or Catalina or Kathleen, any of you are welcome to jump in and unmute yourselves.
Catalina, you want to go ahead and then I follow you?
Yeah, so I think the work that we do, shouldn't be just the work of the Office of Immigrant Affairs. And to that, we're very grateful to you, Delegate Learman, for always elevating the voices of immigrants, because we're just one entity in this ecosystem, right? That's the work that we do every single day. And with the pandemic, all of our weaknesses as local government really heightened. And so it's been challenging for us, but at a minimum, we've had some systems in place. I think we also struggle as local government with this notion of our surrounding jurisdictions and immigrants perhaps not knowing where they live and where resources exist versus not. And to that, we're grateful to Centro Sol and CASA, who are located in serving some of these constituencies. But it's been really heartbreaking for me, at least, not just as a director of MEMA, but as a human being, that certain services that exist in the city may not be available to other jurisdictions. So thinking about a way to elevate the voices of immigrants statewide, I think it should be something to be considered for our next governor, right? I think that in terms of a pandemic, yes, and information being critical in terms of life or death, not having information in multiple languages for us has been really, really challenging. And we know that although we have that, other jurisdictions with limited resources or perhaps not dedicated offices for immigrants are not necessarily thinking about these constituencies. So what are some of the things that we can learn from this, that we can institutionalize at a statewide level, will be helpful to continue to elevate the voices of these constituents?
Absolutely. I think that's exactly the question, is what can we learn from so that we can make it not just a local jurisdiction, but a statewide? Yeah, thank you for that.
So thank you very much for the question. It's very important. I will say that it's very critical that we keep engaging our communities in different levels at the local and state level is so very important. And honestly, it's a moment to call all of our policymakers to pass healthcare for all. I mean, it's kind of absolutely a huge need. I mean, these health disparities show what exactly is the impact for people who don't have health insurance, who don't have anything, right? And in particular, you are undocumented or you are poor, it's so very difficult for you to receive high quality health services for you and your families. So I think that is the responsibility of the policymakers and again, the next governor, to make sure that finally we pass healthcare for all in Maryland. We believe that is from my viewpoint, it's a great investment. It's not an expensive, it's a great investment. Prevention is very critical. Everybody knows that prevention is essential to be able to address all of these issues and to make sure that we are going to help people when it's necessary, when they are in this kind of crisis. So I think that is very important that we send that very important, that we send that message. But also, I mean, again, we have opportunities. In November, we have elections. And also we have also the opportunity to elect people who really we can trust with the same, that have the same values that we have. People who really are going to fight for the immigrant community, for the poor people, for the African American community, for people who are in need. And I think that we have an opportunity that we just cannot, let that pass. I think that is so essential. And I just want to encourage all of the Latinos and immigrants and families, if you are not registered to vote, please register to vote, because people who can vote are the vote and the voice of people who are undocumented. So we have a big responsibility. So thank you.
Yes, absolutely. Kathleen, do you want to?
Hi. Well, first of all, I completely agree with the comments that have been made, and especially the healthcare for all and not excluding everyone is critical. In the meantime, because I don't know how long that will take, I have to say that the state has a role in terms of funding these initiatives. Right now, I can't tell you how many population health initiatives are going on at Hopkins and at the state that are all focused on Medicaid and Medicare eligibility, and that is great. There's a lot of effort to improve many different aspects of population health in people who are on Medicaid and Medicare. The problem is that they exclude that all those efforts don't have any funding for people who are undocumented and ineligible for Medicaid or Medicare. What happens is that all these efforts, including these testing events that we're doing, they're all volunteer and non-funded efforts. And I am really, really concerned about the sustainability of this. Already, the work that we've been doing in and out of the hospital has been what we call a huge minority tax. There have been the 5 minorities at Hopkins who speak Spanish have been working 80 hours a week, some of them with not a very high paying job, and on top of it, they're all volunteers. I mean, it's just crazy. And so, I think we know what needs to be done, and we know what needs to be done for the next wave ahead of. I think we've learned a lot, and the community engagement has been critical. We need to keep on listening to the community, but I am really worried that the next phase, the question of who's going to pay for this, is going to come up front and center, and I'm not sure what the answer is to that.
Yeah, it's a great point. I think that's a really important point. We can't rely, locals or nonprofit organizations can't be tasked with raising all of this money on their own and instituting this. So thank you. There was somebody who wanted to say a few words, Nicholas, who works at Bayview, and he had just a quick comment he wanted to make about SNAP, which is, of course, often, food stamps, what we used to know as food stamps, now known as SNAP, not necessarily available to undocumented immigrants. But if you are an undocumented parent, but you have a child who's a citizen, you are eligible. Nicholas, did you want to ask a question or say something?
Yes, thank you, Delegate. So again, my name is Nicholas Machado. For those of you who don't know who I am, many of you probably don't, but you probably know some of the people I work very closely with. People like Monica and Dr. Polk at Central Soul, the social workers Flor Giusti, Jessica Contreras. I'm directly in the pediatric clinic at Bayview, and we serve a lot of the local community with various needs, mostly SNAP. So what I wanted to kind of bring up today is because kind of during COVID, we've seen a lot of issues within our patients who normally receive SNAP. Yes, due to a lot of the delays happening with DSS, but some specific issues happening that affect our Latino population a little more. As a preface, I just wanted to let anybody know who's on the call is that we're currently collecting a lot of data to bring to our partners at Maryland Legal Aid to help us take this case a little further and elevate it. And I just wanted to ask if anybody is actively working with SNAP cases with Latino families and they are having issues. I would very much like if you could share that with me. I'll type my email in the chat. It's my last name, Machado, Machado @JHMI. To expand on it a little bit, as many of you, oh yes, for sure. As many of you know, there's some issues happening with TCA and SNAP together, whether it's their wait times, issues with their redeterminations, not receiving their letters in English. things like that. I know I don't have time, so I'm not going to go too in detail, but you'll see my email in the chat. I just wanted to ask, and I know there's limitations because it's a state agency. Please let me know if you have patients or families that have issues. Thank you, and thank you, Delegate Lyerman.
Yeah, my pleasure. Thank you for your work. And this is definitely an issue I've been following, so please feel free to reach out to Nicholas if you are working on that, and we can take this up with DHS and continue to challenge it. So thank you. I want to be cognizant of everybody's time, and many of the questions that people asked were answered during the presentations. So I just want to give you an opportunity to sort of add, 1 or 2 more minutes before we break on what's next. How can people stay involved? What should we, you mentioned healthcare for all. What should we be advocating for? How should we keep in touch with you? And what do you see as next in this struggle? And thank you so much for coming. How about if we go in reverse order? Dr. Page, do you want to start us off?
Hi. Hi. I guess not the last time to put my thoughts together, except to say, like I said before, I think we've learned a lot of lessons. I don't think we have all the answers, and I don't think, and I think the things will change. Attitudes change, challenges change. So it's so critical that we keep our finger on the pulse of what the community is telling us. They need us. I think we need to let the community direct us in terms of how we respond and what the priorities are. That we always ask the question of who's being left behind. And really, I think that should be sort of a guiding light. No one should be left behind. And so by thinking every time we do an event, every time we're doing any type of thing, who is being left behind is a question that I ask. I think then thinking with you guys, I'm not a policymaker, but really working together to figure out these are the problems, what are the policy solutions, what are the solutions that we can come up from the healthcare system, and really there's never been a more urgent need to work together.
Yep, thank you, agreed. Catalina?
Yeah, so to me, the biggest concern at this moment is the housing moratoriums and what will happen once those are gone. As you know, a lot of people are falling behind in rent. So supporting organizations like CASA to support some of the communities that Kathleen has mentioned, are being left behind, but also figuring out a way where the state could also be responsive in regards to this, because even as a locality, we may come up with resources. It will never be enough for us to be able to respond to the needs. So housing does keep me up at night. And while we have figured out some type of support, which is very limited in the city, it would not be enough, and not in the next few months either.
Yep, totally agree. And I don't know if you were able to watch any of the briefing yesterday. I don't blame you if you did. My committee had a 5-hour hearing yesterday on housing in the state. And the bottom line is that the governor's just not there. He's not fully committed. And so he's only committed $20 million to a statewide rental support program, when most people estimate that about $154 million is needed. That would be half of the total need, 154, and then we'd rely on the locals to come up with the other half. So, it was incredibly disappointing, to hear from DHCD. They are not taking the needs as seriously as I think they need to be taking it. I think we are setting ourselves up for a huge crisis when renters can't pay landlords, and then landlords lose their, small mom and pop landlords lose their homes, kicking out the renters, and then the Jared Kushner companies of the world come in and buy up those small properties. It's very frightening, and I appreciate you bringing it up, because so much more needs to be done. I really commend the city of Baltimore for rolling out a program yesterday, and they're committing $15 million to it, which is great, but so much more needs to be done. Thanks for bringing that up. And Gustavo, any final words to leave with our guests? Thanks so much for joining us, and thank you again for all your work.
Delegate, thank you so much for this opportunity. I really, really appreciate this. I'm very glad that I have the opportunity to share CASA's views about this issue. But I just want to mention a couple of things. Number one, what you and Catalina mentioned, the housing crisis is right over there. We were one of the organizations that requested exactly $154 million because that is the need. As you know, you received a copy of the letter that we sent to, and it's unbelievable what the governor is doing. I mean, it's so incredible. So I hope that we are going to keep advocating for this. That is very important. That is number one. Number two, of course, healthcare, as I mentioned, is essential for our communities. We need to keep working on this. We need to make sure that we have finally healthcare for all. One day we are going to accomplish this in Maryland and around the nation. I'm very optimistic about this. And finally, I just want to tell you that we are going to start, I believe, an extraordinary partnership with Hopkins and the University of Maryland for the vaccine. They are in stage 3, and now CASA is going to partner with them. We are going to identify 500 Latinos who are going to be part of the test. And we hope that we are going to make a little contribution to resolve the issue of the vaccine for our state, for our country, and for the entire world. So I'm very optimistic that we are going to work on that, and we are going to finally find some kind of relief for our family. So again, thank you so much for this opportunity.
Yes, no, thank you so much. You know, CASA is a statewide organization. It's headquartered in Langley Park, but they just opened a brand new, beautiful headquarters. They're a Baltimore headquarters as well in the Library Square area of District 46, and we're thrilled to have it there after many years of work, so thank you. Thank you to all of you for joining us, and thank you to those of you who are watching. You know, this is a really critical time for our immigrant communities, and everything that we can do to spread the word on how to support them, because the federal government isn't, you know, it's up to us to make sure that these, you know, that our neighbors, and these are our neighbors, that they have what they need, whether that's food or housing support or cash, a check on, you know, just somebody to check in on them, let them know, you know, getting to school, anything that they need, digital divide issues. These are all existing and magnified for folks who cannot have any access to government resources. So I'm so grateful for the work that all of you do. I'm grateful for our immigrant communities and the wonderful and amazing things that they bring, the diversity that they bring to District 46 in Baltimore City. I feel honored to represent such great communities in the House of Delegates. So thank you all for joining us today. Stay safe, be well, and keep in touch. Take care, everyone. Bye-bye.
Thank you. Thank you very much.
Thank you.
Bye.